Okay, I'm going to end this lesson with a few comments about acting about brain death, and that gets us into the concept of moral certitude, which we haven't mentioned before. So we'll spend a minute just what is moral certitude? It's not the same as absolute certitude. It's the certitude that we would require for moral action. So it's saying there that it's an appropriate standard for moral action. I don't have to be absolutely sure that what I'm doing is right and it's going to work. But we have to be highly sure, a high degree of probability. A high degree of probability is sufficient for action, is what an ethicist would say. Decision making needs to be conscientious, based on available knowledge, but not, and I would even argue, can't be devoid of ambiguity, because we're dealing with matters of free will, with matters having to do with human action, and it always is true for the most part. Okay, so we're going to narrow in two different ways. So the first way is we're going to accept the definitions of death or sound. We've raised questions both sides, but for the first look, we'll just say let's just assume that both of them work. And some support we might offer is that we're just out of our field of expertise. We realize that there's a lot of there's some disagreement. We could count numbers. That's not going to really make somebody right or wrong because they have more people believe it. People have looked at this. Okay, so if we just start off, okay, let's say, is one of the definitions more morally certain than others? And I'm going to argue that that is the case. If we look at cardio-pulmonary irreversibility, although that might feel more certain to see somebody's body shut down and stop working, it is only prospective. It requires waiting and trying to resuscitate and eventually deciding that we've done enough, that it's not going to happen. But we don't know for sure. We can never be sure that maybe if we worked on this patient for another 30 seconds or another 2 minutes, we might have resuscitated. So we'll describe the declaration here as prospective. It's not going to happen. Okay. Now compare that to brain death, which is retrospective. It says that death has already occurred. It says that the brain is no longer functioning, and so that patient is dead right now and died at some previous point. The declaration is simply a matter of saying we now know that they're dead. Okay, so it's retrospective. So the argument here would be rather simple. Retrospective certainty is more certain than prospective certainty. In a way, I think that might be kind of obvious. Just think about it for a minute. Okay, the certainty that, well, I never really know for sure, versus the brain death, if it works again, it would be more certain than that.